Hello, 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 hello. Welcome, 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 welcome. Nice to have all of you here. Like, can somebody just send an emoji? Once you join up, just send me an emoji. Let me know that I'm not alone in this chat. Just send an emoji. Send something. Let me know that I'm not alone. Send a message. Yeah, so we're starting right about now. I'm actually waiting. Okay, good, good, good. So we have about 7 people online. That's nice. And okay, we start. So my name is Chiko Dinaka Ezokeke, Dr. Chiko Dinaka Ezokeke, of course, an alumni of Great Madonna University, and been in practice for over 10 years, and I'm just here to share my own bit of my experience concerning hypertension. Now, why I chose hypertension is because hypertension is becoming a tough nut to crack, being that it is one of the most prevalent conditions amongst us in Nigeria. And it has caused a lot of disability, death, and a lot of problems because um, it is more of like a silent disease. So people don't expect it, and it just comes. So that's why I chose this topic, hypertension. And also last week, World Hypertension Day was celebrated. So there'll be no better time than now to actually talk about hypertension. My slide is short, but there's going to be a lot of talking. So I pray you give me your ears and your attention, and make sure you jot down your questions and answers, and I would answer them as we go on. Right. So I start. Okay. Next slide. Good. So my presentation is going to take these outlines: definition, types, scoring, statistics, epidemiology, causes, risk factor, classification. We're going to have a myth busting time, and then we'll talk about the complications of hypertension, the importance of routine checks, the treatment, prevention, and we'll conclude this presentation. Next slide, please. Next slide. Okay, what is hypertension? Now, hypertension, as we all know, is a medical condition in which your blood pressure is higher than normal. So once your blood pressure exceeds the limits of normal, then you're hypertensive. Now, what is normal blood pressure? Everybody has their range of blood pressure. Blood pressure ranges from age. The blood pressure of a little child will, of course, the normal range of blood pressure for a little child will, of course, be different for normal blood pressure range of adults and also the elderly. But in general, with respect to Africans and Nigerians, the cutoff point for us is blood pressures at 100, anything less than 140/90 is normal blood pressure. Anything less than 140/90 and more than 90/60. So take note of this. Anything less than 140/90 and more than 90/60. So they have a range. We have a range of 90/60 to below 140/90. Take note, below 140/90. So that range is what is termed normal. Now, for climes like in the whites, the Americans, Europe, and all that, according to the study they have done, they picked a cutoff point for 130/80. So if you find yourself in Europe or in America and all that, their standard they use for high blood pressure is 130/80, not 140/90. So take note. Now, hypertension is a vascular disease. When we say hypertension is a vascular disease, it means that it is something that has to do with the arteries. The arteries not working as they are supposed to work. You understand? Vascular disease, especially the arteries, not the veins, the arteries especially. You understand? So it's a vascular disease. It has to do with the arteries. Now, what happens is that when the blood normally flows through the artery, the same way water flows through pipes, in a borehole system. You see water flowing, everybody's plumbing system, you see water flowing through pipes. That's the way blood normally flows through the arteries as we go on. So as we go on in our life, blood is flowing from the leg to the heart, from the heart to the brain, and all that. Now, if that blood is flowing at a very high pressure, then you are hypertensive. So if the blood is flowing at the normal pressure, no hypertensive. So it's once that blood is anything that can make the blood to start flowing at a high pressure would cause hypertension. So that's what I want you to understand. So it's about the blood flowing through the blood vessels. You understand? So that's the pressure at which the blood flows through the blood vessels. Now, most of the time, when blood flows through a blood vessel, you expect that if the blood is flowing at a very high pressure and the blood vessel is not strong enough to contain it, what will happen? The blood vessel will burst, right? And that will cause a problem. You see, that's how all these damages occur. The blood vessel will burst and to cause a problem. Or it will happen that with time, the body just tries to adjust to that blood pressure and the blood vessels start to harden and thicken and all that. All these things will now cause issues within the organs that the blood is actually supplying. So I want you to note this. So mainly, this is your call. Sorry, please. Mute, please. As you join up, you mute sorry, please. I have another audience. So pardon me. As you join up, you mute the mics. Yeah, so that's that. So she's being flooded with sedatives. Okay, so that's what happens. So that excessive force is what causes the changes that happen in all the hearts, the brain, the kidneys, all those things that now cause the complications that causes the problem. You understand? Now, let me picture it in a simple way that you can understand. We have a pipe. Let's imagine we have a pipe. You understand? And we have a pipe that can adjust itself. Let's say like a human being, or let's assume that we are going to we as human beings now, let's say like someone like me now, I want to push this I want to push a pile of block. I want to push that pile of block. Now, once the pile of block is like 2 or all that, like 2 and all that, I should be able to push it, right? Good. I'll push it. Now, when it increases to 3, of course, I will still be able to push it. When it increases to 4, I will still be able to push it. Maybe what will not be happening if I continue pushing that block for a very, very long time? What will happen to my hands? My hands will start to thicken, right? So that because my hands are now used to me pushing that block every day. So because of that, my hands will now become just like we have in those who do manual laboring job. You see that they have well-built muscles because they are always lifting, they're always carrying. Before you know, when they started the job, maybe they were lifting one cement. Before you know, they are lifting 2. Before you know, they are lifting 3, and their muscles are building towards that lifting, and their upper muscles, their upper torsos the muscles are actually building up so that it can withstand that load they experience every day. Now, there will be a point, if that load keeps increasing over time, there will be a point where there will be a breaking point. Now, the body will not have the capacity to carry that load again. And if the body tries to carry that load, it will just give away. There will be pain. There will be a lot of problems. That is typically what happens whenever there is raised blood pressure in the body. So that's it. The body has gone beyond its mechanism of adapting to those blood pressure. So it starts to give away. And those are what leads to the complication. Next slide. Now, same thing I've been talking about, knowing your numbers, knowing your numbers. So have this in mind. Once your number, have this in your picture. Once your number is this or more, you check your blood pressure and you see something like this or higher, know that you have high blood pressure. Now, once your number is this or higher, whether it's the up one or the down one that is higher than this figure, you are hypertensive. So note that. Now the issue is not sorry. The issue is not in you seeing that you're hypertensive. The issue is not in you seeing that you're hypertensive, is in the actions that you carry out after you have now known that your blood is running at a very high pressure. So take note of this. Next slide. Note down your questions. After the session, we'll take questions. Take note. So now, basically, we have two types of hypertension. We have essential or primary hypertension, which is the most common form of hypertension, all around the world. Now, they call it essential or primary hypertension because we cannot pin a specific thing that we can say it is causing this high blood pressure. Somebody just has high blood pressure from nowhere. You can't say it is this thing that is causing it or is that thing that is causing it. When that is the case, then it is essential or primary hypertension. And this is the kind of hypertension that is known to majority of the population. Essential or primary hypertension. No cause can be pinned. You understand? No cause can be pinned, but we can pin factors that could cause it, factors that could lead to it, but we cannot for certain say this is the cause of it. So that is essential or primary hypertension. Now, the second type of hypertension is called secondary hypertension. Now, this hypertension is seen in about 5% of the population. Now, this is hypertension that a cause is known. A cause is known. So, for example, somebody has kidney problem and then became hypertensive. So you can say that the cause of the hypertension is the kidney problem. You understand? So somebody has an issue or an autoimmune condition or becomes obese and all of a sudden becomes hypertensive. You can say, oh, it is the obesity that is causing it. Here you can link something to the cause of the hypertension. You understand? Or somebody is pregnant. Somebody is pregnant and all of a sudden the person becomes hypertensive. You can say, oh, is this one is pregnancy induced? This is pregnancy causing hypertension. So that is it. So that is secondary hypertension. So take note of that. Next slide. So now the next is categories of of blood pressure, basically. So normally we classify hypertension into different classes. There are different classifications. Different authors have their different classification, but this is just a simple one that I want you to understand. Now, when your blood pressure is between 140 to 159, or the down one, that's diastolic blood pressure, is 90 to 99. When you have this figure that you see, we say we have stage 1 hypertension. Now, the reason for this classification is that the treatment of hypertension differs at each stage. So that's the reason why whenever somebody is hypertensive and comes to the clinic, we check the blood pressure, check other things, and be able to stage this person and now know what kind of treatment that this person would get or not. You understand? So this classification is very, very important for us as medical practitioners to know, and also important for you so that you know at what point you need to take extreme action as soon as possible. So you see stage 1 is 140 over 159 and 90 over 99. I will tell you later why this stage is important. When we come to management or treatment of hypertension, I will tell you how it applies in that case. Now, so for the next stage is stage 2. Once your blood pressure is greater than 160 or greater than 160 over 100, is greater than 160 over 100, you are in stage 2 hypertension, and then once your blood pressure is greater than 180 over 120. Run, oh, run, oh. This is the point where they say, run, oh. Yes, you have to run, oh, because this is hypertensive emergency. You have to do something urgently for that blood pressure to be brought to normal as soon as you can. So once you see blood pressures greater than 180 over 120, please don't take it lightly. Don't sit on it. You have to run and do something as quick as possible. Next slide. Now, we've seen that hypertension is not a small illness. So you see, we have about 1.20. This is not even the recent epidemiology. 1.28 billions worldwide having hypertension. And majority of these people having this hypertension were found in low and middle income countries. It is more common in women than in men towards the lower end, that's postmenopausal. But premenopausal, it is more common in men than in women. Now, in Nigeria alone, like we said, 1 in 3 adults are hypertensive. 1 in 3 adults. That's how very, very common it is. I've gone for outreaches, and anytime we go for outreaches, I bet you this 1 in 3 plays out, because you must see. There's no time you go for outreach that you will not see somebody who is hypertensive. So for those who want to organize outreach, make sure that you have antihypertensive as part of your medication, because you must see somebody who is not just one person, not just 2 persons. It has played out severally, you understand? So 1 in 3 adults, that's how common hypertension is. Because people who are walking around, their blood pressures are high and they don't know anything about it. Now, only 23 million of this whole number are diagnosed and on treatment. So we still have a lot of work to do in terms of awareness. It's either that people don't want to be treated or they don't want to believe it. But the truth is, the best way to manage any illness is to start early to treat, start early to take care of yourself, to actually prevent complications. Next slide. Now, what are the risk factors? You know, initially I told you about primary hypertension, and I talked about risk factors. You know, what are the risk factors for hypertension? We have 2 types of risk factors. We have the modifiable risk factors and we have the non-modifiable risk factors. Now, please, if you have questions, just send it down in the chat. Send it down in the chat, or write down your questions. At the end of the teaching, we'll answer as many questions as possible. So take note of that. So I'll start with the non-modifiable risk factors. Non-modifiable risk factors, we have things like age, ethnicity, genetics, gender, and all that. Now, it is noted that, like I said, it is more common in the elderly. But recently, we've been seeing a lot of hypertension in young people. You know, we've been seeing that. So take note. Now, we have ethnicity. Now, it is noted all around the world that hypertension is more of like a Black people's illness. It's more common in Blacks. So it is known to be a Black people's illness. Why it is common in Blacks? To today, nobody has been able to say, okay, this is the reason. You understand? So it is more common in Blacks. So hypertension is Black people illness. What is common among the whites is more of diabetes and other autoimmune conditions. But you see, hypertension, I'm sorry to say, hypertension are our Black man, our own sickness. So we have to look, because of that, we have to look out for it. Now, genetics, it is inheritable. So if you have a father that is hypertensive, you have to be careful, because it already runs in your family. So anything can happen and you can be hypertensive. So you have to look for it. If you have a mother, just like breast cancer, if somebody in your family had breast cancer, you have to look out for the gene in you, or else you come down with brain cancer where you least expect it. You understand? So that's how hypertension is. Once you have a mother or father that is hypertensive, you have to be on your toes so that you don't come down with hypertension. You have to do all it takes try to not come down on hypertension. I have a friend, you know, a friend that went to school together. You know, she knew those days in early medical school when they were teaching us about hypertension, the risk factors, and all the many things. You know, she told me, she told me her mother and her father were hypertensive. Her mother was even diabetic. So when she got the awareness that she has to be on her toes, then when she came to school, she was a bit on the big side. Before you know, she started jogging, changed all her foods to more vegetable. She was exercising regularly and all, adjusted her diet, was doing all it takes to stay healthy so that she doesn't come down with any of these chronic illnesses. And I can say, even up to today, it really worked for her. You know, I've talked about gender. Somehow I told you that it is common in males early in life, but towards after menopause, the prevalence in females now becomes more pronounced. So that is the thing. So so for gender, we will not say men have it all or women have it all. It can be split both ways. So so that's that. Now for the modifiable risk factor, there are a lot of non-modifiable risk factors, but if I was going there, I'll be going into more of the medical jargons. But let us stick to this, at least this one. Then we have the modifiable risk factors. Now, modifiable risk factors, we have excess dietary salt consumption. You know, since the Oyibo brought salt into our life, we have liked salt even more than them. Everything in our food is salty. That there's a link between consumption of a lot of salt and hypertension. So take note of that. Now, another thing again is poor diet and obesity. Now, there's a link between obesity and hypertension. So somebody who is on the very big side is at risk of being hypertensive because, you know, those fats deposit around your blood vessel. And you know, when they deposit around the blood vessel does not have the artery does not have the integrity that it should to be able to withstand all the pressure. You understand that it should have been able to withstand before. So all those things now culminate and lead to high blood pressures, you know. No, all the poor diet, consumption of a lot of unhealthy things and all that. Now, excess alcohol consumption has also been linked to both hypertension and heart disease. So we have to look at that. Excess alcohol consumption can lead to, so it's a risk factor. Now, another thing again is lack of physical activity. Lack of physical activity directly and indirectly can actually cause hypertension. Is a risk factor for hypertension. Now, like we said earlier, that most of the people that among the whole population of people who are hypertensive, it was commonly found among the low and middle income earners. So you see where deprivation and socioeconomic status now comes in as a risk factor for hypertension. Then a lot of mental stress, mental health, mental stress, all these things are risk factors for hypertension. So take note of that. Now, the next, we'll go to the next slide. Okay, good. So this slide is very important to me because we want to bust some myths. I want to bust some myths here. So I'm going to be mentioning a lot of things. If just listen to me carefully. Now, some people, and these myths, I wrote them out based on my experience with patients. Now, when you ask some people, when they come to the clinic and your BP is quite high, you know, Nigerians, we like to make excuses, you know, for everything. Somebody will tell you, no, my BP no dey high, my BP no dey high. Now, because I no sleep last night. I wait to make my BP high. Don't worry, if I sleep now, everything will be normal. Far. Your blood pressure is high because you have a predilection to be hypertensive. So that should be, once your blood pressure is checked, even if it's once or twice and it's found to be high, watch out. It's not because you do not sleep at night. There are people who don't sleep at night, but their blood pressure don't get high. So that should tell you something. There are people who don't sleep at night and their blood pressure don't even used to reach up to 120. So that should tell you something. So your blood pressure is not high because you didn't sleep at night. Take note of that. Now, Another one is that they will tell you, hey, this one, I know all of you know this one very, very well. I'll talk to not even on this like this one. I said I must remember it. They say, hey, and when they say, somebody, Ghana hospital. Let me speak. Let me just. She went to the hospital and they told her that her blood pressure is high. Somebody will not say, what is she even thinking, safe? What is she they think, safe? My dear, blood pressure is not caused by thinking. What is she they think, safe? When she her blood pressure go high, it's not by thinking. If your blood pressure is going to be high, it is going to be high. It's not something that you can maneuver, or is by what you did, or it's not. You understand? So take note of this. You understand? So bust that myth out of your head totally. Now another one is I cannot have high BP because I don't stress myself. I know they stress myself. I will get BP. Far. Whether you stress yourself or not, if you have the predilection to have high blood pressure, you would have high blood pressure. So take note, because if you take note of this, it will actually help you to be able to intervene early as much as possible. Now, another myth is that some people will say, I know when my bone they come. Oh, okay. Hello, are you with me? Are you with me? Okay. Once you're not hearing me, please let me know so that I'll rephrase myself. Once you're not hearing me, just let me know so I can go back. Now, somebody will say, oh, I know when my blood pressure is high. My body used to give me sign. I decided to take this before I start talking about the signs and symptoms. You understand? My darlings, sorry to disappoint you, but blood pressure is largely an asymptomatic illness. When I say asymptomatic illness, majority of time when your blood pressure was raised, you did not know. The fact that you went to hospital today and they checked your blood pressure and you say blood pressure is high doesn't mean that it is that day that your blood pressure started to be high. No. Your blood pressure may have been high on different occasions in the past, but you never knew because it is a silent disease. That is why we call it the silent killer. Now I'm going to give you, tell you a story. I'm going to give you a story I had. One time I went for an outreach. Now at that outreach, I saw a very young man. This is a man of about 30-something years old. We checked this guy's blood pressure. Believe you me. We checked it with the digital machine. It was saying error. I was like, okay, good. Let me check. They now brought the patient to me. I said, okay, let me check with the manual. We pumped this guy's blood pressure. The mercury kept going. For the nurses in the house, you understand what I mean? The mercury kept going and going till the very last, and this guy's artery was still pulsating. That's his blood pressure was that high. And I asked this guy, how are you feeling? Any issues? Any headache? He said, there's nothing wrong with me. This, at that point, this guy's blood pressure was already 300 and something over, and we have not still reached the end. 300 and something over or more. And he was not having even as much as a headache. So, my dear, my blood pressure used to give me signs. Sorry. If he used to give you signs, we would have hired you in the hospital so that you'll be our blood pressure robot. Okay, now. So, no, it cannot work. Now, the next myth is, I am too young, I can't have hypertension. Far. We have even little children of 12 years old or below, even coming down with hypertension. So the fact that one is too young does not mean that you won't come down with hypertension. The only thing is that if one is very young and it comes down with hypertension, we normally would look for a secondary cause. Something must be causing it, because it is not common in the young. Does not mean that the young cannot have it. So whenever we see a young person with hypertension, we seek to look for a secondary cause. Something must be causing it, because it's not common for those who are young to have hypertension. Now, for those who are experts, they think they can manipulate, manipulators of the manipulation. Okay, this last myth is for you. You say, I only take my drugs when my BP rise. Oga experts in BP management will soon give you degree, plus stethoscope, join. Yeah, so you only take your drug when your BP rise, abi? The funny thing is that people who say this thing don't even have monitor. They don't even have BP machine that they used to check their BP. They go together with the people that say used to give it sign. So when the thing give them sign, they will not take their drug. So they only take their drug when BP rise. Guy and madam, you can only know when your BP rises by checking your BP. And you should take your drug every day, because this is the reason. If you're hypertensive, you must take your drug every day, because every BP cannot be the same from morning till night. No. As you go about your daily activities, pass through different emotions, your blood pressure is changing. It is going up and down, up and down, up and down. So if you are normal, you're not hypertensive, your blood pressure will stay within the normal limit. Even if it is going up and down, it will not go beyond the normal limit. But if you're hypertensive, your blood pressure will be exceeding the normal limit at every surge. Maybe when you now stretch yourself, the blood pressure shoots. It can shoot and come back to normal when you rest a little. It will shoot, come back to normal when you rest a little. So you can, your blood, because you checked your blood pressure in the morning and it was normal, you say, I will not take it because it's normal. When you now go out and you're fighting with conductor and you're collecting change, or you're arguing about, or you're watching Chelsea and Man City match, you're watching Chelsea and Man City match, and you are shouting, and you don't know that, you don't see that your blood pressure don't shut up. That is why at those points in time, that's why people come down with stroke, come down with all this problem, because they only take their drug when their BP rise. So at that point, when they are happy and they have not taken their drugs. So that is it. So take note of these myths. And if you are in that category, please remove yourself from that category. Next slide. Okay. Next slide. Okay, so like I said, remember this and let this ring in your ears. Hypertension is a silent killer. It is a silent killer because as at the time where it begins to show you signs, it has destroyed 70% of your body. That is why it is called silent killer. It can only be picked, most of the time it is picked up incidentally. Somebody will just go somewhere where they are doing medical action and say, just check my blood pressure, just like that. That's how they will find out you're hypertensive. Or you go to the hospital for something that has nothing to do with hypertension, and you go check your blood pressure and they find out you're hypertensive. Most of the time it is found out incidentally. So that is why it is a silent killer. Majority of the people that have it don't know that they have it, because it can go silent for years. When you start to have signs and symptoms, is when it has reached an advanced stage where sometimes, most of the time, there's really nothing one can do. You understand? Most of the time, people find out they're hypertensive only when they start to experience symptoms of kidney failure. Or they find out they're hypertensive only when they have a stroke. Or they find out they're hypertensive only when they go blind, just suddenly. Or they find out they're hypertensive only when one thing, their heart begins to fail. That's the thing. So don't wait. When you find out that you're hypertensive, take action immediately. So that is it. So when you get to that severe stage, anytime you take part in strenuous activity or any form of stress, it could cause headache, visual disturbances, vomiting, convulsions, convulsions. You understand? But apart from that, it is largely asymptomatic until it becomes complicated. So that is it. So don't say, now when if I get headache, I know say na my BP. No, it may even your BP may even be shooting up, and you're not even having as much as a headache. The next slide. Now, this slide is to tell you about the complications of high blood pressure. Now, I always cherish this slide when I'm in the clinic. I always cherish this slide because if once I see a person that is newly diagnosed hypertension, before the person starts to say, "Hey, it's not my portion. What God cannot do does not exist." This one, that one, I'll tell you. See, these are the complications of high blood pressure. So I will not tell you. Take action on time or be at risk of having this complication. You have to do something. You must do something. If it is pray, go and pray. If it is lifestyle modification, go and do the lifestyle changes. But you must do something. So complications, number one, starting from the head. Hypertension can affect the brain, can affect the eyes, can cause blindness, can cause stroke, different types of stroke. There's a kind of stroke we call hemorrhagic stroke. That stroke happens when the blood pressure is too high and it goes and bursts the blood vessel, the artery in the brain. Once that artery just bursts like this, you know what happens now. The brain cannot take any more fluid because it's already full. Most people don't survive it. That is one form of stroke. There's another form of stroke that hypertension causes. That one is just blockage of the artery. That's the one people survive, but sometimes people can survive with some form of disability. Either they cannot move their hands, or their face will be one side, or their whole body becomes paralyzed and all that. So that is what hypertension can cause. Now, if there are some people that may not have stroke, but with repeated insults in the brain, repeated insult because of the high blood pressure, repeated insult, when they grow older, they tend to have early dementia or early Alzheimer's disease, especially dementia, vascular dementia. They tend to have early vascular dementia. So they start to have cognitive decline very early because of the repeated insults as a result of the repeated high blood pressure. So that's that. Now, come down from the brain to the heart. Now, the heart is a very essential organ. Now, the heart actually takes the brunt of that high blood pressure. You understand? Because as that high blood pressure is coming, it is hitting the heart. As the blood pressure is coming, it is hitting the heart. The heart takes the brunt of it. So the heart will try to sometimes enlarge, sometimes thicken to cope with the blood pressure. As it keeps thickening and enlarging, thickening and relaxing, thickening and releasing, before you know, the heart muscles will die because it has gone beyond this elastic limit. And when the heart muscles start to die, what will happen? The heart will fail. So different types of heart failure, from heart attack or what we call myocardial infarction, to different types of heart failure, cardiomyopathy, different types of heart failure the heart will exhibit as a result of that high blood pressure. So the heart will fail and all that. Now, the heart has a twin brother called the kidney. You understand? The heart has a twin brother called the kidney. Now, the kidney, sorry, just give me a minute. Let me add somebody to call. Now, the heart has a twin brother called the kidney. Now, the kidney is also like the heart. The kidney is also like the heart. You understand? So everything that happens to the heart tends to happen also to the kidney, because the kidney suffers when the heart is suffering. So when the kidney is suffering, the heart is also suffering. You understand? So when the heart fails, of course, the kidneys would have, because the kidney, apart from being the heart's brother, you understand? The kidney has the power, another extra abido shaker, according to what's this guy's name? Has an abido shaker. You know, that the kidney, what it does is that it helps to control blood pressure. You understand? It is where all the compensatory mechanism is housed. All the compensatory mechanism to help to control the blood pressure is housed. You understand? So when the kidney tries its best to control the blood pressure, it cannot. The kidney will start to sacrifice itself in the process of trying its best to control the blood pressure. And once the kidney dies out, who is the twin brother that takes the brunt of the kidney dying? The heart, before the brain and every other place. So that is it. So the kidney is the organ most hit when somebody has high blood pressure. It's the organ mostly because it is the one of the important organs responsible for the control of high blood pressure. So take note of that. So apart from that, there are some other special functions, that some arteries, have and all that, So that's when doctors talk about sexual dysfunction, when there's high blood pressure, and all that complication that may result as a result of treatment. We talk about peripheral arterial disease, where the arteries start to misbehave, maybe thickening. When the arteries start to over thicken, once it thickens, now reduce blood supply to other parts of the body and to cause another problem. You understand? Then when hypertension happens in pregnancy, oh my God, it's usually disastrous. It can lead to a preeclampsia. How many women survive it? We lose many women regularly as a result of eclampsia or preeclampsia. So that is the thing. So high blood pressure has a lot of complication and the essential organs that are needed for survival. And once these organs fail, that is when you begin to see all the symptoms, the leg swelling, your leg will start to swell, cognitive decline, your heart will start to fail. You notice that you that used to run 1 mile without getting tired, only to climb down staircase, you're already breathing like somebody that ran marathon. You understand? Or you can't even do the normal things. You're easily getting tired. Your eyes are puffy. Everything. All these things are complications of high blood pressure. So once you start to see signs and symptoms, you know that there's already complication as a result of the high blood pressure. Next slide. Now, treatment. See, I told you our slides are not much because I want to give enough room for questions. Now, for treatment, the aim of treatment, the aim of prevention, the aim of everything we are doing to try to control this blood pressure is to prevent complication. The blood pressure being raised does not impact, but the complications that come as a result of it is what makes your quality of life not to be good. You can imagine if you've had a stroke, you can imagine a young person having a stroke. The person is already disabled, the person cannot move about, the person is hanging in there. Of course, the person will not enjoy life as they should, So those are the things we're trying to prevent. We're trying to prevent all these complications. So that's why we must find out early. We must find out early and we must treat early. We must find out early and we must treat early. So now we have two treatments as in form of treatment. We have the medical treatments and then we have the non-medical treatments. Yeah, for the medical treatment, that's where we talk about drugs, where there are a lot of drugs for hypertension. And every day, new drugs keep coming out. Now, I must say something in regards to drugs. You see, you are not allowed to take another person's antihypertensive. You are not allowed to go to a chemist to go and buy antihypertensive. I will tell you why. Now, you are not allowed, you understand, to allow somebody who has no clinical acumen on hypertension to prescribe medications for you. Antihypertensives is not anti-malaria, where one drug can fit everybody. No. I told you that different drugs, and those different drugs have different places that they perform their function. You understand? And they have different indications for it. So antihypertensive is not paracetamol or Panadol that you can take and your wife can ask you, where is your where is your paracetamol? Give me, make I take, and you will take. And anybody can take even from a stranger on the street and you take. No. Antihypertensives are not like that. There are different classes of antihypertensive, and there are so many. So before we place anyone on any antihypertensive, we will normally conduct tests for you. We will examine you. And after examining you and conducting all the tests, the results of those tests and the examination and our history taking will determine the type of antihypertensive that will be prescribed for you. I have two examples I'm going to give you with regards to this. Number one, I had a patient whose wife was a nurse. A nurse, I don't know whether she was even a trained nurse, but she's a nurse. Now, the person was hypertensive. And when the wife discovered that he was hypertensive, guess what? The wife placed him on propranolol. Now, this drug is a drug that is not even a regular antihypertensive. It's a drug that we prescribe for people whose heart beats very, 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 very fast. Now, not only did she place him on the propranolol, she placed him on a very, very high dose that by the time this man was coming to the hospital, his heart, short, he had fainted multiple times because his heart has slowed down multiple times. At the end of the day, that man died. Because that man died. It didn't even take long. The man died. Now, that's one example. Now, another example, I had a patient who had hypertension and had heart failure. Now, the types of drugs we give to people who have hypertension and heart failure is different from the type of drug we give to people who have hypertension alone without any complication. Now, this man had hypertension and heart failure. My first week of seeing him, the first visit, we gave him a 2 weeks appointment. He felt better after taking the drugs we gave him. So he felt that because he's now, he has felt better in 2 weeks, he can now become a gandusa, according to Odumeji. So guess what? This man went back for the next 1 month appointment he gave them, took his drug for 2 weeks, and then when his drug finished, according to him, he did not have money to buy that same drug. He now collected drug from his in-law and started taking. Now, those drugs he collected from his in-law were not good for the heart failure. So he started getting worse. By the time he came back to shop, he could not even wait for his appointment. He had to run back to the hospital. And when I questioned him, I found out that his drug finished and he was taking drugs from his in-law. And most of those, it was still the same antihypertensive, but that drug is not good for the heart failure that he had. So with these two examples of mine, I can see that people can see now that hypertension is not a one drug fit all situation. Now, even when somebody has very, very high blood pressure, I know that it is usually the practice that when somebody just goes to the hospital, before you know, they'll just put nifedipine under his tongue. For the nurses that are here, they'll put nifedipine under his tongue. It's not every hypertensive emergency that needs nifedipine under the tongue. So every hypertension, every patient should be treated as an individual patient. Every person should be treated as an individual person. You must be examined and be sure before they place you on medications, and those medications are right fit for you. You cannot go and be taking this is where marriage cannot work, because your wife is hypertensive and she's taking her drug. You say, darling, dear, give me some of your drug, make her take. You know go work. If your drug is different from her own, except in a situation where two of your drugs are the same. That's when the love can continue. But you see, when the drugs are not the same, the love cannot continue. So take your own. Let her take her own. Take note of this. Now, the one that I want you to take home is the non-medical treatment, which is lifestyle modification. Next slide. Aha! Now this is where me and many people fight today. I'm sure some people have their bossing glow. They're ready to fight me now. Now, lose weight if you're overweight. We have had people testify that when they lost weight, their blood pressure returned to normal. Yes, it can happen, because there, the risk factor for the hypertension was the obesity. And when they lost all the fat, their blood pressure came back to normal. So that is it. So if you're obese, you're at risk of having hypertension. You lose weight, your blood pressure will come down. Now, next thing is alcohol intake. Alcohol is a no-no. It's not a friend to the kidney. Neither is he a friend to the heart or even the brain. Alcohol is not a friend to the essential organs that are affected by blood pressure. So whether you're hypertensive or not, please limit your alcohol intake. In short, there was a recent study that showed that even the smallest intake of alcohol is not good for any of the heart. But people are still saying that, hey, it's controversial. Hey, take a glass of wine. No alcohol. Even that study that said that any drop of alcohol can still put you at risk. Even the study that even told you that 1 glass of alcohol is okay, or if you take how many grams of alcohol is okay, will still tell you you are better off when you don't take any at all. So fight me, if you can. A word is enough for the wise. Now, one of the major problems is that we like salt too much. Now, about salt, I've had to say this every time. Note that every food that you consume has salt. So before you put salt in that food, have it in mind that even the rice that you are eating has its own salt. Everything that you are eating has salt. You understand? Everything that you're eating has salt. So when you are adding salt to that food, have this in mind, and all that. Now, physical activity is very, very important. It is already determined that 150 minutes of exercise per week is recommended. That is 30 minutes of exercise at least for a day or 3 times in a week is recommended. Now, eat a lot of fruits and vegetables. You can never go wrong with that. When you eat a lot of fruits and vegetables, food rich in fruits, vegetable, low fat, and all that is what we call DASH diet. That's dietary approaches to stop hypertension. Once you eat food that is rich with fruits, rich with vegetables, of course, you would have a reduced risk of coming down with high blood pressure. Now, another thing again is that you reduce your consumption of saturated fat as much as possible. Then lastly, smoking. Hey, God. Smoking can cause your blood vessels to be hardened, and that could lead to blood pressure. The tobacco itself contains a lot of toxins that are not good for the body at all. Not good for the kidneys, not good for any part of the body, even the lungs, the heart, and all. So you'll be doing yourself a service if you keep smoking. Smoking is bad for the health. So try as much as possible to stop smoking, and this would help you reduce the risk for high blood pressure. Now, for exercise, I'll buttress on that. 150 minutes of exercise per week. Now, look at it. It says, next slide, please. It says, aerobics can reduce your blood pressure by 5 to 7. Endurance training can reduce your blood pressure by 10. Now, but the catch in exercise is this. Now, when you check your blood pressure and your blood pressure is high, my brother, my sister, please don't go and do exercise. I beg in the name of God. If your blood pressure is high, please don't exercise, because you are calling stroke. You want to stress your heart, that is trying to manage to control blood pressure. You want to stress it. Please, I beg you in the name of God, Don't try to exercise when your blood pressure is high. You are calling problem. You are calling problem. Especially that our exercise that we do in the night, please. That one especially. We have had people, we have lost people, people have died. That one in the night. You people know the one I'm talking about. Open your ear. That one in the night, please. You can sure before you do it, check your blood pressure. Check your blood pressure. I beg you. Yeah, so that's it. So now, high blood pressure is not is not something that should make you scared. It is very easy to control. Sure, next slide. That's next slide. So, from there's one of my consultants I used to say, if he will tell you that if he's to choose between diabetes and hypertension, that he will hug hypertension with all his power. Yes, so because when you look at it, diabetes affects every single cell in the body. But hypertension is something that you can easily control. Some of the time, the drugs is only one tablet you take once in a day. Most of the drugs are usually taken once a day. So it is easier to actually manage than any other chronic illness, hypertension. It is easier to manage than any other chronic illness. So that's why is something that you should not give up or say, oh, because this thing is high. Next time, because this thing is high, then I beg, I've given up. After once you follow all the lifestyle changes, take your blood pressure check your blood pressure regularly, take your medications, you reduce stress as much as possible. Once you do that, you will be on top of it. You control your blood pressure without stress, and you will live your life as though you have nothing. No, so you can prevent once you can reduce all these toxins from your life. Next slide. All these toxins from your life, you can largely prevent it. So don't be alarmed if you're seeing hypertension. Instead of you to run, it's not cancer, so you don't run under your bed. Is very easy to control. So have it in mind. It's very easy to control. All you just know is just to have the resolve that you're ready to do what all it takes to control blood pressure, and it will be very easy to control. Now, so in conclusion, next slide. In conclusion, hypertension is a major cause of death and disability worldwide and needs to be treated once diagnosed. Like I said, it is very easy to treat. And the aim of treatment is to prevent other organ damage. We advise for those who are hypertensive to check their blood pressure daily. They should have a journal where they record their blood pressure. It will help even the people who are monitoring them in the clinics to actually know how well they have done at home, because sometimes the real show is not what is happening in the clinic, it's what is happening at home. So once you record your blood pressure regularly and you go to the hospital and you show your doctor how your blood pressure is, the doctor will be able to know where to come in and help out. So that's that. So you can also visit the doctor. Like I said, it's very, very important if you're hypertensive to go for routine checkup. It is very, very important to go for routine checkup. You cannot be a doctor of yourself. No, you must go for routine checkups regularly. Let's see, because sometimes anything can happen. Nigeria is a very, very scary place. You can buy drugs now, you think it's original. You take it's not working. If you're not going for routine checkup, you will not know. You understand? So go for routine checkups, and the highest thing that can happen is, oh, you go, they check your blood pressure is normal, they will give you thumbs up, well done, you go back. It will not take anything from you. And once your stats are good, they'll give you a long appointment, so you don't have a problem with that. So, but always visit doctor regularly. There may be something new that they will teach you in the clinic that you will not hear anywhere else and anything. So that's it. So make sure that you always visit doctor regularly for routine checks. Thank you so much for listening to me so far. So this quiz section will happen on the Madonna University on our WhatsApp chats, but I'll take questions for now. So you can send in questions for now. Then after the questions, I'll take the quiz on the WhatsApp chats. Thank you so much.
Hi, doctor. Doctor. Let me use my fake Ghanaian accent. So, first of all, let me ask one very stupid question here. So, I was having an argument with my elder brother in the alumni. So, he said his watch can actually take blood pressure. I was like, is that a thing? So, what can you say about that? Like, rather than using the normal stethoscope and all that cool stuff, we have devices now, like, you just wear your hand on it. Are they really accurate? Are they advisable?
Okay, yeah, based on research, the ones that actually are wrapped around the best way to check blood pressure, the recommended way to check the blood pressure is with a device that has a cuff that is wrapped around the lower end of the arm. You
Okay.
know, blood pressure, not those watches or one thing that your app on your phone that you put your finger and the thing will check your blood pressure. No,
Oh, it's a watch. It's a watch now.
that's not your arm. That's
Oh, it's a arm.
the low.
Sorry, no vex. My school
You know,
fees.
there's a major blood vessel there, the brachial artery, that the cuff will wrap around it and press it and starts to record the pressure around it once you are once you tight it and when you again. That is what is for this thing. However, that doesn't mean that those ones are not reliable. But we always have our, what is recommended. You understand?
Recommended, yeah. Hmm.
So
Okay, I
Randy,
think the
just
Bella wants to
just
add
yeah,
something.
just to mention, like the wristwatch actually states that when you take the reading, you shouldn't use that as a conclusion.
Ah,
You should still,
Ah,
take a professional reading. It's supposed to probably just give you an idea. Okay, this is what your pressure is looking like.
okay. Okay, so I will go and read questions from the app now. Okay, let me see. Okay, first question comes from our own OG, who is supposed to be happy about that, sure. So she says, what are the triggers to blood pressure?
when you say triggers, yeah. I don't know what exactly she means. You understand? Anything that gives you stress or puts you in a stressful state can be a trigger to your blood pressure, can make your blood pressure rise. Emotional
Okay,
stress at all, whether bodily stress or anything, can be a trigger to your blood pressure rising. But when people ask for trigger, I hope she's not trying to say cause, because there's a difference between a trigger and a cause, and there's a difference between cause and risk factors. You understand?
all
But
right.
and you go and do something that is you go and do something strenuous, your blood pressure will surely shoot. But if you're on medications, that blood pressure will not rise beyond normal. To still, the medications will know how to stabilize the blood pressure within the normal rate, no matter how activity you carry out. So that's it.
Okay. So next question comes from Genevieve. I don't know which are the Genevieves, but she says, but but why is my blood pressure always so high when I'm sick?
Sickness is a stressor. And if your blood pressure is high when you're sick, you're hypertensive
Ah,
every day and their blood pressure is not high. So if your blood pressure is
updates.
140, it is higher than a high up to 140 over 90, then you're hypertensive. It should be checked.
Okay.
And because you only got to check because you were sick and you were in the hospital and you checked. Those times when you are not checking, it would have gone high also, but you did not know because you did not check. So that is it. You only got to check because you were sick and you were in the hospital. That's why, and they got to check for you, or you went somewhere and got it checked. Those times you were not checking, it would have also been high, but you will not know. So for the fact that your blood pressure once or twice and it was high is a call for you to be checking your blood pressure regularly, because at those times when you least expect, your blood pressure would have also gone up. So that is it.
Okay. All right. Thank you. Next question is from Ebelen. Ebele, what is this thing you wrote here? Eclampsia. Said eclampsia. Because what was that?
Now, waiting doctor talk. Oh, I've never heard it before. So she just, she
But you call
mentioned
Bella.
eclampsia and pre-eclampsia.
You're
So I was
spelling
wondering
wrong.
what it was. Is that what?
The hypertension states in pregnancy.
Oh, okay.
Pregnancy.
Why didn't you just call it hypertension? Why they must stress person?
You can send it to the box, sir.
Okay. So next question comes from Hannah. She says, please, what causes low blood pressure?
Huh?
What causes low blood pressure?
Okay. What causes low blood pressure? I may not be able because we are talking about hypertension, but I'll just give you a clue. You understand? Anything that will make your blood pressure become lower than normal, you understand, it calls for action. You have to go to the hospital and be sure that there's nothing wrong with you before you can assume that who normally has blood pressure. I'm an example. My blood pressure does not go beyond 100/60. Sometimes my blood pressure even comes down to 80-something/60-something. That's how low my blood pressure can get most times. You understand? So my blood pressure is between that range of 80-something. It's not because I'm sick or anything. You understand? But over time, I have recorded my blood pressure on several occasions, and it has been within that range. So I think that I'm one of those individuals that our blood pressure is not overtly, on the very high side. I've had a lot of people who are like that also. You understand? So that is the thing. So if you have low blood pressure, go to the hospital as soon as possible. Okay. Just give me a minute. Somebody is about to ask me another question. I don't know this one.
No.
In another place. Okay. Okay. The link has expired, so don't worry. Another link will come and I'll send back to them. Don't worry. Go on. You can go ahead.
Me?
Yeah. You can go ahead.
Okay. So this one comes from Tochuku. So he says, I heard the moment one sends high blood pressure tablet down their throat, there's no stopping. Is that true? Wait, that's not that question.
Yes. It's not a matter of when one sends high blood pressure down their throat, it is not stopping. Hypertension is a lifelong illness. It has no cure. If you're taking medication and your blood pressure comes down, it is that drug that brought it down. It is a lifelong illness, just like diabetes. You understand? It's a lifelong illness. So once you start taking medication, it is advisable to just continue taking the medication. Do you understand? So it's not something that you will take, and then tomorrow you will say, I'm not taking again. No. You cannot say I'm not taking again. You have to keep taking it, or else that blood pressure will shoot up and you have complications. Now, this is what I tell my patients. Are you considering? Don't look at the fact that you're taking medication. Now, some of our patients that like to claim this thing. That like to claim like they know. I tell them. You understand? Now, you have hypertension. You have hypertension. To treat hypertension, maybe you just buy one drug that maybe costs between 10,000 to 15,000 in a month, and you'll be taking that drug once a day. You take it for a month. You buy another one. You take it for a month. Now, on one side. Now, on the other side, you have hypertension. You don't take that. You don't take drug. You leave it. You pray. You continue going where you are going. Years. You come any problem. Now you are needing transplant. You are needing millions. You are needing this. Dialysis every day. Your life starts to go. Every day you are tired. Every day you cannot sleep. You cannot walk. Your leg is bending. Disability. Your heart. You cannot breathe. Which one do you prefer? The one that you be taking your drug every day, every month, and you are okay, or the one that you have to sell all your land to maintain dialysis, and you have to sell everything that you own to get kidney transplants for you to live well? Which life do you prefer? So that is it. But when you consider that hypertension is a lifelong illness and that you have to be taking drug all the time, remember that the complications are far worse and can make your life miserable. So when you're hypertensive, take your drugs regularly so that you don't have complications and you will live well like your friends and the other person without anybody even knowing that you are hypertensive. Thank you.
Doctor, so you are saying, right, if someone is hypertensive and they start doing all those things you mentioned, like, living properly, avoiding smoking, reducing alcohol, no salt, exercising properly, are you saying that it will never ever become okay without the drugs?
Now, there are different stages. Thank God. Thank you for asking that. Thank you for that question. There are different stages of hypertension. There's a stage of that the smoking and eating and that will be to control your blood pressure without any complications. You understand? That's stage 1. But you cannot say I have stage 1 and you say, hey, doctor told me that I have stage 1. All I need to do is exercise and all that. And you don't check your blood pressure regularly. You just go blindly. You say you stop smoking, this or that. You're not checking your blood pressure. How will you know that you are getting better or you are getting worse? How will you know? That's the problem we always have with our patients. Now, once you tell them you are stage 1, at this stage, you don't need to take drugs now. All you just need to do is institute lifestyle measures, to control your blood pressure and all. They go back and they just relax. Some of them carry out, some of them don't. And at the end of the day, when you see them in the next 5 years, they have come down with complication. And it will now be looking as if doctor did not tell them the right thing. Do you get?
Yeah.
So, practicing the lifestyle modification, it can control your blood pressure if your blood pressure is in stage 1. But you have to be monitoring it. You have to be checking your blood pressure to be sure that you're on the right track. Your blood pressure is normalized within normal, fine. There's some people that it normalizes and it's fine, no problem. But once your blood pressure starts to go to another stage, and at that time, you're supposed to present yourself back to the hospital for you to be commenced on medications. So that is it. In short, in the new recommendation now, because of how people, the research that has been done over years to show that it has not been productive leaving just go and be doing lifestyle modification alone, because most people don't come back and all those things and they tend to get worse. You understand? The research showed that it is safer to start, once you catch somebody that is hypertensive, you start immediately. Start them on drugs immediately. That's the recent recommendation. And the research, because of the performance, so far, they found out that people are not doing what they're supposed to be doing. Do you understand? Keeping to the recommendation, and it has not worked. When you institute a treatment, you have to do research so that giving you figures. But it wasn't giving the right figures because the people factor cannot be eliminated. So the best research now given is that once you see somebody who is hypertensive, commence the person on medication, even if it's only one medication. So now, because we have combination of medications, we combine 2, 3 medications. Even if it's only one medication at the lowest dose, commence. That's the new latest information, because we cannot trust that that person will be able to stick to the lifestyle modification, will be able to be checking their blood pressure regularly. Okay, let us ask, how many people who are hypertensive actually have his fig? I know how long I kept campaigning for people in my clinic that everybody who is hypertensive must have his fig. I know how long before people start adhering to it. And I can see that people who have blood pressure machines do better than those who don't have blood pressure machine. Because if there's no way you will check your blood pressure and your blood pressure is high, that you will not take action.
Okay.
People don't tell yourself the truth. So when you check your blood pressure regularly and your blood pressure is always high, it will push you to action no matter how. So those who have machines do better than those who don't have machine, because those who don't have machine don't know whether their blood pressure is high or not. They just go with this assumption. But those who have machines, we check regularly and they are able to tell when they are doing well and when they are not doing well, and they are able to take action as soon as possible.
Okay, thank you. Randy. Doctor, are you able to see the app as here? Okay, Randy, are here. If are there some more
Sorry, I had
questions?
to respond to some work stuff.
Okay. Are there more questions?
You're kind of breaking. I can't hear you. Yeah, but I think you asked if there are more questions. And yes, there are questions. Oh, crap. So Rosemary is suggesting if a BP check and sugar level check and blood level check can be done at our meetings. That she's suggesting to the medical team.
Uh,
Don't know how possible.
Now we have a lot of people who are not willing to work. You understand? And I'm no longer I'm no longer around, so I would have loved to do that regularly, but because it is very, very important. You understand? All it takes is just to if the alumni can buy a SFIG dedicated for the alumni, then at every meeting somebody can just volunteer to check the blood pressures and just to make sure that our blood pressures are fine. But it should be a must at every gathering that we check ourselves and just to be sure that we are all good and we are all fine. So it will always be a welcome development. I tried to do that before I left, but it wasn't in enough response in regards to that.
Okay, so a question from Rose. Oh, okay, very interesting questions. um, very. What is this? Okay, where did you know that your? Huh? My question is where you did not know that your family member doesn't show or have symptoms of hypertension, but your grandparents had. Would it be passed to your grand grandchildren? I think she's talking about the genetic part of the hypertensive thing. If it doesn't show, maybe if is it dominant or recessive? I don't understand. Maybe something like that.
No, we leave it past. It's not about whether you know or not. As long as it's in that family, it could be passed. There's a high percentage of it being passed. Do you understand? As long as it's in that family, there's a high percentage of it being passed. My mom and my dad are both hypertensive. So I'm already taking precautions. I'm already doing all it takes to stay healthy. Watching my weight and everything, stay healthy. You understand? So checking my blood pressure regularly and all. You understand? So it's not about you knowing or you not knowing. As long as it is in the family, there's a high percentage of it being passed to the children, to your children. If it misses you, glory be to God. But somebody down the line will have it. There's a high percentage of the person having it. So that is it.
Sorry, 1 minute, I'm coming. Okay, we have more questions. Questions are popping in now. Tochuku says, I have panic attacks whenever I see VIO, especially. Do panic attacks cause high blood pressure?
Panic attack if you are hypertensive and you panic, of course, your blood pressure is going to shoot up. So if you know you're going to go to a place where you're going to be panicky, of course, you expect that your blood pressure is going to be high and you are hypertensive, please take your medication. You understand? But if you're on your medications, you don't have a problem. Even if you have panic attacks, no problem. Your blood pressure, your drugs are all the good thing about hypertensive drugs is that you take them, majority of them are taken once a day because they can cover you throughout the whole day. They have good 24-hour coverage. You understand? So anything that happens throughout the day, it covers you well. It slows down your heart, it manages everything well while you're on the medication. But if you don't take any medication, there's no cover. Anything can happen. Now, let me give you an example. I have the patient I had a stroke. Now, this patient, when I asked the patient, are you hypertensive? Say, yes, I'm hypertensive. Do you take your drugs? Say, yes, I take my drugs. Then what happened now? I was almost deceived. And second, somebody just told me that I asked him, did you take your drug today? He said, no, he missed his drug today. I said, you see, the drug he took yesterday covered him for yesterday. He didn't take drug today, so he left room for the devil to attack him. Yeah, so that is it. So he went and he got to a place where there was a trigger and he had a stroke just because he didn't take his drug for one day. So you see how important it is to take your drugs regularly. You understand? So that's once you're hypertensive. That's it. So the drug you take yesterday and 2 weeks ago does not cover you for today. Every drug covers you for only one day. Take a drug today, it covers you for one day. You take a drug today, in another day, it covers you for one day. So that's how it works. So that's it. So
in summary, we are saying Man U fans who are hypertensive should always be on the drugs.
Man U fans, hey, before you watch your match, please, I beg you, take your drug.
So again, people who are hypertensive and have panic attacks, I don't like horror movies. They should not watch horror movies with that.
Yeah, they should not watch.
Right?
No, they did not take their drug. Don't watch.
Okay. So basically, in summary, is so okay. But wait, though, I'm trying to get something here because from what I have been saying since, I understand that if the hypertension is in your family, like your lineage, it can pop in sometime in the future in your life, or it can pop in. So you just have to be aware. You have to check to be aware. So what about people who don't have it in their generation? Then all of a sudden it now pops in. I feel all these questions start talking about trigger causes. Maybe that's where they are going to, like, something should lead to the hypertension. So that's I think you spoke about those already, Sha. You spoke about the alcohol, lifestyle, obesity, and all that stuff.
You may not have in your lineage, but it is very, very difficult for me to believe that. You know why I can't believe that? Most of our parents are died as a result of hypertensive complications and they don't know.
Yeah.
Very, very difficult. It's very, very difficult for me to believe that throughout your generation, you know, one person now, it will be very. It will be very, very difficult.
Okay.
We have grandparents who never went to hospitals if they died. The truth is, even if my village, I was concerned the other day. People in my village, I noticed that many of them don't live to 120 years. I'm just wondering why. What did do the 100 years? No. Even if they're old, some of them 80, 70, 60. When you come to the Western world here, you see people living to very old age, and you'll be wondering who causes us, who do a strong thing. You go to some people's villages, the oldest man is 60-something years. 40-something person is already on working. Yeah. Yes. So because we don't, there's no awareness, people don't check. You hear, the guys up. The next thing our people are thinking of is village people. They're not even thinking of that it may be high blood. It's village they are thinking of. Okay. There was a guy I met in the workplace. There was Valentine's Day that night. The next day morning, they brought him in as a corpse. What will happen? He slept. He did not wake up. What is the culprit? Where my mind going? Hypertension. Because Valentine's Day, who knows what gets down? You know what gets down now?
Okay, now.
Breakfast served. Valentine's Day breakfast.
The next minute, people are coming down with a stroke in the hospital. I don't get. I never get it before. What do you think is the culprit? Hypertension. It is there. It's very prevalent. I've told you, I've had outreaches, and we are seeing 1 in 3 different stages of hypertension. So it is very, very common. There's no two ways about it. Very common. Most people don't know because they have never checked. And once you check and you know, you need to take action against complications. Why I'm talking about complications, that I've worked where I see people who are having kidney issues because of hypertension that they didn't control on time. They are running about for donor of kidney, this one, that one, because of hypertension that they didn't control on time. They are having stroke because of hypertension they didn't control on time. They are having heart disease. Now, let me shock you about this complication. If you come down with kidney problem, the highest number of years you have to live, maximum. If you come down with heart complication, heart is even the worst. That one, there's no remedy. Once your heart has failed, just count 3 years, max 5 years, 3 to 5 years. Mortality, death. Because you take all the drug in the whole world. That's how the heart will keep coming down, declining, because it has failed. It has failed. It's just, the drug is just helping you to manage. Just helping you to manage. The decline will just be progressive till the end comes. Stroke is the best of all the complications. Stroke. If you survive, that's if you survive it. Because as much as the best of all the complication that even gives you another chance at life, it could also come like night and off the person. Is the best and the worst of it all.
You say kidneys, how many? I think so. I didn't hear that part. And somebody also commented they missed it.
3 years. 3 years.
3 years.
3 years.
Wow.
Even if you are doing that, if you get transplant, perfect. Your continues. But without transplant, even if you are doing dialysis, I say I have patients who did not even live 3 years. So you live 3 years is even testimony. They need. I have patients that not even stay up to 1 year, even with that. And the truth is that once somebody has kidney failure, for you to survive, you have to do dialysis at least 3 times per week. At least 3 times per week. Before I left, was 35,000. And you must have it at least 3 times a week. In Sena Climb, Western Climb, people just walk in and do dialysis every day. They can even go every day dialysis. That's why you see the survival rate is better for them than talking about 9. You understand?
Mm-hmm.
In Nigeria, the maximum they can times, as in that's the maximum, means that these people are politicians, they have money. The maximum thing is twice a week for those who have money. Even I'm sorry to say, by one of the vice president's person that's in dialysis, you understand? He could only still do twice a week. You understand? really very, very rare to see someone who is 3 times a week dialysis. Or the only person that I know that have had that 3 times a week dialysis, that one, he already had a donor for transplant. So he was doing it very well because next time he traveled, before you know, he had his transplant, and before you know, he was good. For them, for you to live normally, you must have at least 3 times a week dialysis. Even with the dialysis, maximum is 3 years. Even with the dialysis. So that's why they will tell you definitive management for kidney failure is transplant. Are scary. I see how go from bubbly to unwholesome. I don't even know how to even to vegetables within a space of 1 year. So I understand these complications, and I've seen people go from rich to poor. I've seen people go from rich to poor because of the money. I know a young guy who came down with heart failure. He could not manage the drugs. He couldn't, because one of the drug alone for his heart failure was 18,000 naira at that time. Now that drug is 30,000. It was 18,000 naira at that time per week. And that's not the only drug. He was on 7 other drugs. Just one of it. He was on 7 other drugs. So it was on like 8 drugs. One of the drugs was already 18,000 naira per week. He took at the time. He could not handle it. His business crashed. Everything scattered. You understand? He stopped business. Everything. So complications are what we fear most. So the fear of complication is what will make me fear to tell somebody, say, now that you are sensitive and you are not, take your drugs. Do something. You don't have complications. Most of those have people who are scared of taking drugs. I've prescribed medications for them that are very, very tiny, that they just throw in their mouth like this, and they will not even feel like they're taking drugs, and they'll go their way and they're fine. Once you're fine to be hypertensive, it will not kill you. Just take that little drug and go your way. And the next day you take it again, and you'll be better having complications, because complications, you will not like your life at all. There was a young man that we feared committed suicide because he was very, very poor, and so at the time he was presenting with kidney failure. He could not even afford to feed himself. So when they brought him dead, it was almost certain that this guy, because he left home and just disappeared, and the next minute they're bringing him dead. So it was almost certain that this guy must have weighed out the situation and committed suicide, because by the time they were able to gather money for the first session of dialysis, second session of dialysis, and he just could not take it anymore. You understand? That is how bad the complications can be. So if you're not scared of the complications, I don't know what else should motivate you to take your drugs if you're hypertensive. Something that needs to be taken care of, and needs to be taken care of as fast as possible once found to be hypertensive. Then if you're not hypertensive and you have a family history of hypertension, it is something that should scare you to more. So that's it. Any other question?
Yeah. So let me see. Okay. I think this is chairman, but he asked a question that somebody already asked about. Is it true when you start taking BP drugs like amlodipine and co, there's no stopping? I think you answered that already. Chairman, I think the question to that is yes.
It would be good for you to continue till forever.
So then another question from Hannah. She's asking, can hypertension lead to blindness?
Yes. That means she must have joined late. Hypertension.
Yeah.
There's a kind of blindness that it can cause. It can cause both transient and it can become permanent. It can lead to blindness. It can also worsen a glaucoma. It can lead to blindness. Short. Hypertension can lead to blindness.
Chioma has a question, right? About I think she also joined late. She says, does smoking cause hypertension? But let me just maybe add more to the question. Is there a type of smoking that does not cause? Does shisha cause, or is it only smoking cigarettes or cigars or smoking Indian hemp? Do all types of smoking cause hypertension?
Yes, all types of smoking cause hypertension. Now, all because the elements are nephrotoxic. And what that's nephrotoxic means that it's toxic to the kidney. And what did I say about the kidney? The kidney is an essential organ with respect to controlling of blood pressure. And once the kidney is poisoned early, what will happen? The person will start to have high blood pressure because the organ that is helping to control the blood pressure is no longer working as it should work. You understand? The worst of is even the marijuana. Marijuana is even the worst. You can shut that one down. Even talk of cocaine. Cocaine is even the worst. You understand? As in all of them are toxic to the kidney. Because the truth is that everything you put in your body affects your body somehow. And which organ takes care, purifies the blood? Is it still the same kidney? If you rub something that is toxic, everything goes to the kidney. If you inhale something that it will still enter the bloodstream and the blood to still go to the kidney. By the one that it detoxify, then the one that will kill it will still kill. So the kidney is an essential organ that no toxin should get to at all. So when we go through life and we come in contact with all these things that are toxic, we should remember that the organ that is detoxifying the body, that is in charge of detoxifying the body, is still that kidney. And that kidney is the one in charge of the controlling of the blood pressure. So when you take things that will stress the kidney, what do you think will happen? All the activity that the kidney is doing to control the blood pressure will shut down. And who will suffer? Is you that will still suffer it at the end of the day. So whether it's a shisha or shake or whatever you are smoking, and it is toxic to the body, your hypertension. That's that. I'm sure pretty wide. That's the reason why a lot of coming high blood pressure, right? A lot of young people are coming down with high blood pressure right now, and most of them already have some stage of kidney disease. So we should be careful. We should love our kidney. Kidney is very important. We should love our kidneys. Anything that can harm the kidney, stay away. So that's it.
Randy, I don't think there's any other question, is there?
Yeah, that's what I was about to tell her. She basically just joins Chama Sandra's question. She was asking if smoking causes hypertension, and I think you just addressed that. So, yeah, I think we're done. There's nothing on the WhatsApp group. Like, I think all the questions were posted on the app. So,
I think she has
pretty much.
There's another session she has. I think Q&A or something like that.
From the other side. Do they have a question? Oh, okay.
And is chairman available to join?
Is it my network or Doc?
Huh?
Hello?
Okay, I know you have a quiz. You have a quiz section.
Can you like know who answers the question the fastest? Chairman is there, Abi, for the gifts, the quiz section.
Is chairman not available to connect, Randy?
Chairman has a link. Oh, I don't know.
Okay, so can you bump him? Just remind him.
Wait. This was it.
Somebody still asking another question. Why we try to get chairman? Somebody says, what causes hypertension in pregnancy?
There was a question before that one.
Okay. Actually, it's not the same. It's not also related. It says so hypertension that was pregnancy induced does not have a cure. Okay, I think she can join it too.
Yeah, sure.
Pregnancy induced. It's one of those, like I told you, that most of the time hypertension has no cause. You can't say that this is what causes it. This is what, so we can't know who is going to have. If you can know a cause of something, you'll be able to tell who is going to have the hypertension or not. You understand? So we can't tell who has the hypertension. There may be some genetic predilection for preeclampsia or some other factors too that may have caused it. You understand? Which I may not be able to explain all through to you. You understand? So the issue is, it is common that people have hypertension in pregnancy. The thing about hypertension in pregnancy is one of the hypertensions that actually gets cured, because this is the cure. Once the person is no longer pregnant, the hypertension stops. You understand? Now, there's this theory, once someone is no longer pregnant, like, so when so that happens. So once baby, but there are some situations where even after the delivery of the baby, will still be hypertensive. Now, in such situation, the person probably may have been hypertensive before that pregnancy, but maybe did not know. That's what we now call chronic, as in post-pregnancy hypertension, chronic hypertension. The person did not know he has hypertension, and most of the time, when you see people who had hypertension in pregnancy for the first time, and then later after delivery, their blood pressure did not come back to normal. You understand? Yeah, we normally, if you look at them closely, you see that most of them have family history of hypertension. There must be hypertension somewhere in their life before that happened. So the person just continues to be hypertensive. Now, so situation, the person is already hypertensive, but majority of persons who come down with hypertension in pregnancy, after the delivery of the baby, the hypertension resolves. So that's why it is called pregnancy-induced hypertension, because it's hypertension that was induced by the pregnancy. So before the pregnancy, the person was not found to be hypertensive. Then all of a sudden, the person becomes pregnant and then starts to record very high blood. Now, pregnancy normally is supposed to kind of lower the blood pressure. The process of pregnancy is supposed to lower the blood pressure. You understand? But you see that instead of the blood pressure to be a little bit lower, they don't get that deep. You see the blood pressure tending to rise, especially at the last three semesters of pregnancy. And some of them even get the severe forms and start to have seizures and all that. And some of them may even die or have very, very, very bad complicated pregnancies. You understand? That's it. That they must check your blood pressure. Want to find out that you're pregnant, that you're hypertensive. You doesn't get complicated. So that's the thing. But saying that there's, as in, what is causing it? Cause when it comes to hypertension, please don't put your mind on cause. Now, like I said initially, when we talk about cause is only if we are sure this hypertension is secondary. It's secondary per se, as per this person was not hypertensive before, right? And you understand? Then all of a sudden, this person becomes hypertensive because this person had kidney problem. And most of the time, like I told you, secondary hypertension is usually seen in the young. This person has polycystic kidney disease. Then all of a sudden, because of the decline in the kidney, the person now has hypertension. So that polycystic kidney, the person might have had it since, and the person was not hypertensive. So the person starts to have hypertension because the kidney function is declining. You understand? Or any other thing. Or the person may be sickle cell, because sickle cell is another thing that can cause secondary hypertension. And over time, the person begins to develop high blood pressure. You understand? So they will now suspect that maybe the sickle cell is already destroying the kidneys, which now led to this hypertension. You know, so that's the thing. So we have room for secondary hypertension. You know, and pregnancy-induced hypertension is one atypical type of secondary hypertension. But every other hypertension, there's no cause. No cause has been pinpointed. So we are not looking at cause now. The aim is not to look at cause. The aim is to diagnose early and start treatment on time before complications set in. So that's it. So if chairman is not ready, we can do the quiz on some other day now. When I read, just like we can do the quiz on some other day. We can do the question and as in the quiz.
Fair enough. Fair enough.
So no other questions. Can I?
James is busy with some other stuff though, because he actually dropped a message. Oh, okay. I think we are done. No questions. Yeah, no more questions.
So thank you.
Yeah, your people on Google Meet. They don't have questions to ask.
the time has ended. They didn't join.
Oh. Oh, okay, fair enough. At least we have a recording of this. I will not say where. We have a recording of this. So I was calling you Dr. Chika, and Hesky is correcting me. He said it's Dr. Chico. Never heard that before. But, well, thank you very much, man. We appreciate you. We appreciate your time. We appreciate the efforts, the energy. And please, I beg. You see, as all of us, they do our own. Please don't feel like, okay, because people are not plenty. Because even me, like, sleep is doing me. I want to go and sleep. But I had to be here to make sure this goes well. So thank you very much. Really appreciate. So people, as usual, if you have any questions, you can drop it on the WhatsApp group. We'll definitely make out time to answer, just as we did on Thursday for the malaria talk. So for those who are not opportune, we have it on the app. Okay, I think I better back. We will have it on the app for those who want to watch it again. Let me get this guy on board. Bella, right?
Yep. See you till the next webinar. We will have the archives. At some point, we'll create archives.
Abby, at least the malaria talk and all the other talks.
Yeah.
Sorry, Chika, the first one you did was on what again?
Huh?
The first talk you did, what was it on?
I did what I think I talked about health generally. It was on health generally.
Oh, anyway, that one we have a recording as well. If you want the recording, I can always send it to you.
So we'll work on this. I think we can work on an archive section of the webinars. These things are very, very, important. They are filled with a lot of information that people pay. Yes, people pay millions to get. So I'm surprised that people are not taking advantage. Maybe in some years down the line, they will start looking for the information.
For sure now, for sure. Thank God for the internet. The internet never forgets. It's always going to be around.
Internet they forget. No,
So, yeah. Bella, any closing remarks? Why is one a full close for office?
They go gym now. You're waiting doctor talk. Doctor say 3 times a week.
Hello. The gym animal. Elisa. I was putting up her pictures at the last fitness waka. She was ignoring them and keeping face like she's not seeing them.
Oh, now you they even put them. I think now she they put herself. I think maybe she they market one Jimmy something.
Now she that on that day when she was showing herself, anyhow. I should gonna ignore her. I said, oh, let me free her. The moment I brought slides back, next slide. So you were seeing them. I said, okay, nice one. 1-0, you tried. Come on, people. So, anything else? I think questions on WhatsApp group. Today there's no musical. There's no partying today like last time. I beg.
You drink alcohol today now. Why now? Last time you did drink. As doctor say no. As doctor say alcohol one thing. You don't keep your alcohol. It's okay.
Danny, don't run, leave you.
Let me continue my alcohol. You think we are playing around here? Let me continue.
An alcohol.
You think we are? See, doctor say minimize your intake.
She say minimize. Actually, she say minimize because my alcohol, you know, go loss.
When we started, I was already on it. But when I started talking, I said, let me go and drop it. Now that I spoke, I'm back.
But it's not.
Doctor, anything happened to me, I'm calling you. At least you saw how it happened. So don't ask me so many questions. It's alcohol.
I've seen the.
Doctor,
Yeah.
on a side note, when you have some time, maybe like throwing like different data, you know, the on the health section of the app, on the different calculators, you can throw in data there. Maybe if you have some reviews or say, okay, we should change some text or something in there. Though it was not built, it was built with one of your colleagues, but you know, four eyes are better than two. So maybe there might be something you might see there. You want to maybe give an opinion and say, okay, you can always reach out to Randy or myself and say, okay, let's update this on the app. I think it will be better like this or like that.
Yeah, no. So on that note, people, thank you for.
Thank you, doctor. Thank you, Randy.
Thank you, Ebele. You guys can go and party now. Permission granted. You can. And this man is going to the gym. See, your pot belly is not going to go there in Jesus' mighty name. It's going to remain there forever.
Yeah, I need you too. Oh, well, that's it. That's it.
It's not going anywhere.
That's it. Had to come out to try,
bro. Oh yeah.
Is the hardest.
Allow you go gym. Let me go and sleep.
No wala, no wala. Nice one.
Okay.